and you want to let it air dry. So now that we've cleaned that area, you want to grab the muscle right here, and this is the area in the muscular area because it's an intramuscular shot. With the needle, you want to bevel up. You want to have the bevel up, and you're going to go in. You're going to enter. It's going to go in like a dart, like you're throwing a dart, and you're going to enter right in the area. You're going to aspirate, checking to see if there's any blood in there, and you see no blood, then you're going to inject and out. You want to get a gauze and wipe it and rub it a little bit. You want to make sure and close up your needle. Can you hold this right here? Apply pressure. You want to make sure and close your needles, all of your needles, and you're going to put them in the sharp container. Okay, now you want to put a band-aid on that area. Cover the sleeve and make sure that she's nice and comfortable now. Are you okay, Ms. James?
I did not feel it.
Okay, good.
You can pinch the muscle first and then clean. It's up to you as long as you know where you're going. And I've already purged the air out of the vaccine. So I'm going to go ahead and pull up the muscle. I'm going to go straight in. Are you ready? 1, 2, 3, straight in. Because it's a vaccine, I do not need to pull back on the plunger. I'll give the vaccine, put the safety needle on, and she's done. Some nurses like to rub the area prior to putting the vaccine in.
For the actual injection, you need to find the landmarks, and in the deltoid, you want to find palpate for the acromion process and go about 2 finger breadths down in the mid-axillary line, and that's a good place for the injection to go. So once you have your injection site, you want to clean it off with an alcohol swab. Let it air dry. When you're doing the injection, the needle should be bevel up. And when you're ready to inject, you want to put some tension on the fascia so that it doesn't move anywhere. And in a quick fluid motion, go straight into the muscle. Stabilize the needle with the other hand. Aspirate to make sure you're not in any vein or vessel. And then when you've done that, you can just simply inject and remove. And if you have any bleeding, simply wipe it up with a gauze pad and apply your Band-Aid.
So just relax your arm down by your side, keep it nice and relaxed. And starting in the center point, you're going to take your alcohol swab and you're going to swirl it around. And the reason why you're doing that is you're swiping the area away from the injection site, okay? So rather than just a full swipe, you're going to do it in a circular motion. So you want to make sure that the alcohol dries, which only takes a couple seconds. If not, it's going to sting. And so he's ready for the injection. You keep him relaxed. I'm going to hold my hand here and then go straight in with the needle. If you inject the medication slowly, then the patient's not going to feel it as much, so it's less painful for the injection. If you push it in really fast, then you're going to feel a little bit more. So you'll notice I had my cotton ball in my hand, which helped so that I could quickly put the cotton ball right into the area right after I've injected it. Just apply a little bit of pressure into the area at that point, because sometimes you might get a little bit of drop of blood. At that point, either you can leave the cotton ball on and put the Band-Aid over top, or you can just take it away and put the Band-Aid right into that area. You're going to squeeze, relax the arm, make sure, see how the shoulder dropped. Okay, so even between 30 seconds that I was explaining stuff, he had done this. Okay, so look at the shoulder, make sure they relax. Okay, you have to watch for that in your patient or it's going to hurt them more than it needs to. Okay, pinch, get nice and close, bevels up, go straight in, don't hesitate. Coming around, aspirating, making sure no blood, inject. And you want to make sure too that you're not dimpling that skin, don't push it in. Come straight out. And notice I came out at same angle of entry, right? Now, this is muscular, so we massage the site. We want to take that medication and disperse it out. Okay, we don't want it sitting there in a giant ball.
Hold the syringe near the hub. Insert the needle at a 90-degree angle all the way to the hub of the needle. Maintain contact with the patient at all times. While supporting the patient and the syringe, depress the plunger in a smooth and coordinated manner. Immediately activate the safety device. Dispose of the syringe and needle in a sharps container. Press the cotton or gauze over the injection site and secure this to the patient using the adhesive bandage. Hold the syringe near the hub. Insert the needle at a 90-degree angle all the way to the hub of the needle. Maintain contact with the patient at all times. While supporting the patient and the syringe, depress the plunger in a smooth and coordinated manner. Quickly withdraw the needle. Immediately activate the safety device. Dispose of the syringe and needle in a sharps container.
You feel for the bone, and at least 5 inches below is the injection site. You want to stay at a 90-degree angle and make sure to aspirate. You take your non-sterile gauze and withdraw the needle. Make sure to always aspirate, and then you're done. Always remember to have a sterile gauze with you.
Take a deep breath and hold your breath. Slowly let your breath out.
Oh, it's not too bad. I feel it now, actually hurting.
Okay. Take another deep breath and hold your breath. Slowly let your breath out.
It feels a little heavier now. That's the only thing I've noticed.
Right,
Yeah.
because you're getting more in that arm. Okay, now you're going to take a deep breath and hold your breath. You're going to slowly let your breath out.
I felt that.
Okay, we didn't want that.
What happened? Was it bleeding?
Yeah. Another deep breath. Hold your breath. Slowly let your breath out. Now you should have 4 insertion sites. Then all 4 of them should be right around each other.
Okay.
Okay.
Cleanse the injection site with an alcohol prep pad by circling from the center of the injection site outward. Allow the site to dry before administering the injection to reduce the stinging sensation. Inform the client about the upcoming steps and console as necessary. It is more comfortable if they keep their arm relaxed during the injection. Remove the needle cap. With a non-dominant hand, hold the patient's skin taut by spreading or bunching the skin between thumb and index finger. Hold the syringe between thumb and index finger of the dominant hand. Using a quick motion, fully insert the needle at a 90-degree angle to the arm. Stabilize the syringe with the non-dominant hand while using thumb or index finger of your dominant hand to depress the plunger slowly to inject the drug. It is not necessary to aspirate in the deltoid, but some clinicians prefer it. Remove the needle smoothly along line of insertion. If using an internal safety needle, the needle should retract from the arm once the plunger is fully depressed into the syringe. Internal safety needles will require additional stabilization with your non-dominant hand to activate the retraction once the plunger reaches the hub of the syringe. Immediately dispose of syringe and needle in a sharps container and apply a bandage to the injection site.
And hold the skin taut.
You're going to go in at about 72 to 90 degrees, okay? And once you go in, you just insert at that angle. You're going to aspirate. Whenever you aspirate, you're going to take the plunger and you're going to pull back just a little bit. Make sure you don't have any blood. You're not in a vessel. And here we're not, of course. And then you're going to inject the medicine just straight through like that. Hold in there for about 10 seconds so the medicine can get good inside the muscle. And then you are going to pull straight out, engage your safety, put it in the sharps box, and then put your Band-Aid on the patient. Sometimes patients bleed, sometimes they don't. Band-Aids love to stick to gloves, so be aware of that.